This is All India Radio. We now bring you a special program on COVID-19. Good morning, I am Sarabjit Kaur and with me is Tanvi Taneja. The headlines. Third phase of lockdown comes into effect with considerable relaxations in green zones. Prime Minister Narendra Modi to participate in NAM Summit through video conferencing today. Central teams being deployed to 20 districts with highest number of COVID-19 cases. Recovery rate of COVID-19 patients improves to over 26% in the country. And Uttar Pradesh government makes Arogya Setu app must for those in hotspot areas. The third phase of lockdown arising out of COVID-19 pandemic comes into effect today. Centre had on Friday announced extension of lockdown for 2 more weeks after 4th of May with considerable relaxations in lower risk districts. Health Ministry has divided over 700 districts of the country into red, orange and green zones and Centre's guidelines will be followed according to the zone. Union Minister Prakash Javadekar has said that in green zones, practically all day-to-day activities have been allowed barring congregations. He said government wants to give the message that India is undergoing a phased exit from the lockdown where more and more activities are allowed to be conducted. He said NDA government is determined to save lives as well as reboot the economy. More from our correspondent.
Travel by air, rail, metro and interstate movement by road is not allowed even in the third phase of the lockdown. Schools and educational institutions will remain closed. However, all agriculture-related work would continue to be permitted. Industrial and construction-based activities in rural India, including MG Narega works, food processing units and brake kilns would also work as usual. In green zones, all activities other than those not permitted nationwide would be functional. Buses would operate in such zones with 50% seating capacity. Transportation of all goods traffic is permitted across the country. Standalone liquor stores and pawn shops are also allowed to function in non-containment areas. OPDs and medical clinics are permitted to operate in all zones with social distancing norms. All in all, the third phase of lockdown pushes a set of relaxations to bring back normalcy in life and trade. Stay safe and maintain 2 gaj ki duri. With Suparna Saikia, Anand Chaturvedi, AIR News, Delhi.
Delhi Chief Minister Arvind Kejriwal has said the time has come to reopen the national capital as it is fully ready to relax lockdown restrictions. He said Delhi is prepared for lifting the lockdown other than containment zones and he will suggest the central government to declare only containment areas in the city as red zone and not the entire district. Briefing the media, Mr. Kejriwal said the lockdown was necessary to contain COVID-19 and now the city is prepared to deal with the situation. He said we will have to be ready to live with coronavirus. The Chief Minister said the revenue and employment are being adversely affected due to the lockdown and Delhi will not be able to sustain the restrictions for long. Standalone shops, neighborhood shops and shops in residential complexes selling liquor, pan, gutka, tobacco are allowed as well to operate, ensuring minimum 6 feet distance among customers. Mr. Kejriwal, however, said Delhi government will implement all lockdown restrictions prescribed by the Home Ministry and city government offices engaged in essential services will function with full strength, while private office will open with 33% strength. Mr. Kejriwal informed that the suspension of travel by flight, Delhi Metro and bus will continue in the national capital.
Curfew has been lifted in Chandigarh. The city was under curfew since March 23rd midnight. The nationwide lockdown will prevail in the city with some relaxations. Though Chandigarh still figures in 130 red zone districts, but movement will be allowed from 7 a.m. to 7 p.m. The internal standalone shops will be open from 10 a.m. to 6 p.m. on odd-even system. Shops selling essentials like groceries, vegetables, medicines will be open on all days. Liquor vends in sector markets will be open. Distribution of fruits and vegetables by government buses will continue. Lockdown restrictions which will prevail in the city will be that people have to wear masks while moving out and observe social distancing. Assam government has restricted the movement of individuals between 6 p.m. and 6 a.m. throughout the state across all zones from today. Assam Health Minister Himanta Biswa Sarma said restrictions will not be imposed on medical services, police, fire services and emergency response for restoring telecom and electricity. He also said that private medical clinics and OPDs shall be allowed to open, including veterinary OPDs. All standalone shops shall be allowed to operate till 5 p.m. Auto rickshaws, cycle rickshaws and taxis shall operate with one driver and 2 passengers, maintaining social distancing. The minister said constructions in urban areas shall be allowed with a maximum of 50% workforce. City buses, intra-district and inter-district buses shall operate with 50% capacity. Also, government and private offices shall operate with 50% of employees. In Bihar, there will be no green zone. All districts will either be under red or orange zones. Additional Chief Secretary Home Amir Subhani said the decision has been taken in view of the rise in number of corona cases in new areas and return of migrant workers and students from other areas. The number of corona patients in the state has risen to 517 with 36 new cases detected yesterday.
Centre has clarified that its order allowing movement of migrant workers, tourists, students and others are meant to facilitate movement of the stranded persons who had moved from their native places and workplaces just before the lockdown and could not return due to restrictions. It said the movement during the lockdown is meant for such distressed persons and not to those who are otherwise residing normally at places other than the native place for the purpose of works and wish to visit their native place in normal course. 2 special trains carrying stranded persons at Kerala and Ajmer Sharif will leave for West Bengal today. These arrangements have been made by the Railway Ministry as per requests of the West Bengal government. In Madhya Pradesh, to bring back more than 1 lakh labourers of the state stranded in various states, a proposal to run 31 Shramik special trains have been sent to the Ministry of Railways by the state government. A report.
31 trains from Maharashtra, Gujarat, Haryana, Goa and Delhi will come to Bhopal, Jabalpur, Ratlam, Rewa and Katni stations by taking labourers stranded in these states. After testing the health of all the labourers, they will be allowed to board the train. The rail fare of all these labourers will be paid by the state government. In the first phase, maximum number of 22 trains will come from Maharashtra. Additional Chief Secretary ICP Keshri has informed that the labourers will be sent to their respective districts through buses from the railway stations, where their health tests will be conducted again. All the labourers will have to stay in the home quarantine for 14 days after returning to their places. Sanjeev Sharma, AIR News, Bhopal.
Meanwhile, 798 people have recovered from coronavirus infection and discharged from hospitals. The number of coronavirus cases in the state has risen to 2,837, while 156 have died.
In Maharashtra, migrant workers travelling to their home states will have to seek medical certificate from the local municipal corporation hospitals or clinics before they apply for pass for interstate travel from the local police station. These passes will also be issued to people and students from other states stuck in Maharashtra following the nationwide lockdown since March 24th. About 100 people, mostly migrant workers from suburban Dahisar and South Mumbai, were yesterday permitted to travel to their native states, Rajasthan and Gujarat, in 5 buses. Our correspondent tells us more.
Through a circular issued by the Mumbai Municipal Corporation Administration, it has been informed that the medical clearance certificate will be issued only to people not suffering from any influenza-like symptoms. Similarly, registered private doctors too can issue these certificates. Of the total 441 positive cases found in Mumbai in last 24 hours, Dharavi slum sprawl alone has reported 94 new cases and 2 deaths, taking the overall number of cases in the slum to 590. Sonali Ghadal Patil, AIR News, Mumbai.
Local administrations at the state, district and panchayat levels all across the country are continuing to take various initiatives to check the spread of COVID-19 pandemic. And the Pradesh government has set up a control room for helping stranded people. Andhra people who are stranded in other states can call 08662424 and other states people stranded in Andhra can call 1902 and give their details to get help to go to their places. Similarly, permissions have been given to industries located in the green zone and they have started operations. Migrant labourers are permitted to go from one green zone to another green zone and work with adequate precautions. In Kerala, 40 NSS volunteers are taking turns to work at the district medical office on the collectorate premises, tracing primary and secondary contacts of all people who came to the district from other countries and states since COVID-19 outbreak. In Telangana, the State Pollution Control Board has requested general public, urban local bodies, healthcare establishments and common biomedical waste management facilities to follow specific procedure or guidelines for handling, collection, transportation, treatment and disposal of biomedical waste generated from COVID-19 patients or suspected people. In Mizoram, the local bodies have permitted the villagers to work on their farmlands with an instruction to maintain social distancing under certain conditions.
In Uttarakhand, all precautions are being taken by the village pradhans in view of COVID-19. Villagers are following the guidelines of the government regarding corona. Chief Secretary of the state, Utpal Kumar Singh, told AIR that panchayats have been asked to follow the guidelines.
ग्राम प्रधानों को समय समय पर उनसे अपील किया है कि जो सोशल डिस्टेंसिंग के मानक हैं पालन गांव में हो, जो लॉकडाउन करने के आदेश हुए हैं उनका भी अनुपालन वो करवाएं। साथ ही में जो हमारे कृषि कार्य हैं वो एग्जेप्शन की सूची में है, अतः कृषि कार्य या औद्यानिक बागवानी, डेयरी, मत्स्य पालन इत्यादि ये कार्य करते हैं।
Agricultural activities are taking place in the villages of the state, observing social distancing and wearing masks. Developmental works are in progress under Manrega. Gram Pradhan of Jakneali village of Tehri Garhwal district, Rishita Shial, said that villagers are getting benefits of government schemes.
हमारी ग्राम पंचायत में मनरेगा के तहत नहरों, चेक डैम आदि कार्यों का निर्माण किया जा रहा है। इसमें 100 से अधिक ग्रामीण मजदूर कार्य कर रहे हैं। ग्राम पंचायत में जिन लोगों के कार्ड बने हैं उनको तो रोजगार मिल ही रहा है, लेकिन उन लोगों को भी जो कि कोरोना संक्रमण के चलते अन्य प्रदेशों से गाँव लौट आए हैं, उनको भी मनरेगा योजना का लाभ दिया जा रहा है। इसके अलावा भारत सरकार की विभिन्न योजनाओं का लाभ भी मेरी ग्राम पंचायत को मिल रहा है, जैसे कि जन धन योजना, उज्ज्वला योजना, समाज कल्याण की विकलांग, विधवा और वृद्धा पेंशन भी लाभार्थियों को मिल रही है। प्रधानमंत्री गरीब अन्न योजना का मुफ्त राशन मेरी ग्राम पंचायत को मिल रहा है। इस महामारी से निपटने के लिए प्रधानमंत्री श्री नरेंद्र मोदी जी द्वारा जो कारगर कदम उठाए गए हैं, हमारी ग्राम सभा जखन्याली मोदी जी का बहुत बहुत आभार व्यक्त करती है।
Prime Minister Narendra Modi will participate in the virtual non-aligned movement NAM summit through video conferencing today. The summit will discuss and decide on the enhanced coordination of the member states in their fight against the coronavirus pandemic. The special online summit of the heads of state and government of the NAM member states has been convened at the initiative of President Ilham Aliyev of Azerbaijan in his capacity as current chair of the movement. The summit will conclude with a political declaration of the movement as uniting against COVID-19. NAM represents the biggest grouping of countries outside the United Nations, comprising 120 developing countries from Asia, Africa and Latin America.
This is All India Radio bringing you a special news program on COVID-19. Let's take a look at the headlines once again. Third phase of lockdown comes into effect with considerable relaxations in green zones. Prime Minister Narendra Modi to participate in the NAM summit through video conferencing today. Central teams being deployed to 20 districts with highest number of COVID-19 cases. Recovery rate of COVID-19 patients improves to over 26% in the country. And Uttar Pradesh government makes Arogya Setu app must for those in hotspot areas. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
लोकप्रिय धारावाहिक महाभारत प्रतिदिन दोपहर 12 बजे और शाम 7 बजे डीडी भारती, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। डीडी 60, टाटा स्काई 1194, एयरटेल 151, सन डायरेक्ट 326, वीडियोकॉन डीटीएच 480, डिश टीवी 197 और डेन 522। समय याद रखें, दोपहर 12 बजे और शाम 7 बजे। प्रतिदिन देखें लोकप्रिय धारावाहिक महाभारत।
अथ श्री महाभारत कथा।
As many as 20 central public health teams from the Ministry of Health and Family Welfare have been formed and are being sent to the 20 districts that are reporting the maximum number of COVID-19 cases in the country. These districts are Mumbai, Pune and Thane in Maharashtra, Ahmedabad, Vadodara and Surat in Gujarat, Southeast and Central Delhi, Indore and Bhopal in Madhya Pradesh, Jaipur and Jodhpur in Rajasthan, Kurnool, Krishna and Guntur in Andhra Pradesh, Agra and Lucknow in Uttar Pradesh, Chennai, Hyderabad and Kolkata. These teams will support the states in implementation of containment measures for COVID-19 in the affected areas within these districts and cities. The teams will assist the state governments. Home Ministry Control Room will be utilized for resolving complaints and issues of drivers and transporters on passage of goods carriers, including empty trucks for interstate movement during the extended lockdown period. Drivers and transporters can use the control room number 1930 to lodge any complaint pertaining to the lockdown. In addition, NHAI helpline number 1033 is also available for national highway-related grievances. A report.
The officers of Road Transport and Highways Ministry are also being deputed in the control room to assist in complaint and grievance resolution. They will also compile daily report on such complaints. The centre has already directed the states and union territories to ensure uninterrupted movement of trucks, and this decision is expected to greatly address the issues and hurdles in the movement of goods across the country during the lockdown. Divakar, Air News, Delhi.
Government has asked states to speed up procurement of minor forest produce to support tribals in the backdrop of situation created by COVID-19. Tribal Affairs Ministry has said that the states have initiated the process of procurement of minor forest produce, MFP, and operations have begun in 10 states. Procurement of over 20 crore rupees has already been undertaken in the current financial year till date.
The government has said that Lifeline Udan flights have delivered over 795 tons of medical cargo across the country during the lockdown period. The ministry said a cargo air bridge was established with East Asia for transportation of pharmaceuticals, medical equipment and COVID-19 relief material. The recovery rate of COVID-19 patients has improved to over 26% in the country. A total of 10,887 people have recovered after treatment and were discharged from hospitals. In the last 24 hours, 682 patients have recovered. The total number of confirmed cases in the country now stands at 40,263, while a total of 1,306 deaths have been reported so far. With this, there are now 28,070 active cases in the country. Health Minister Dr. Harshvardhan has urged people to observe the extended period of lockdown in letter and spirit and treat it as an effective intervention to cut down the chain of transmission of COVID-19. A total of 427 new confirmed cases of novel coronavirus have been reported in Delhi during the last 24 hours, taking the total number of cases to 4,549. Delhi government has confirmed that 1,362 patients have been cured and discharged so far, and 64 deaths have been reported in the national capital.
Delhi Police has said the movement passes issued by it earlier for essential services will remain valid till 17th of May. Earlier, the Ministry of Home Affairs issued an order under the Disaster Management Act 2005 to further extend the lockdown for a period of 2 weeks beyond 4th of May. In Jammu and Kashmir, 35 new positive cases of novel coronavirus were reported yesterday, taking the total number of positive cases in the Union Territory to 701. Out of these, 287 have recovered so far, whereas 8 patients have fallen prey to COVID-19. Moreover, the recovery percentage of the patients affected with coronavirus pandemic in Srinagar, Jammu and in the Union Territory as a whole are also gradually increasing with each passing day. More from our correspondent.
5 districts in Jammu division, Doda, Kishtwar, Udhampur, Poonch and Jammu and Gandarbal in Kashmir division are totally corona-free. 31 patients also recovered yesterday from Kashmir division and 2 patients from Udhampur. Meanwhile, the recovery percentage of patients in Jammu division is 87%, whereas in Kashmir division it is about 37%. The overall recovery percentage in the Union Territory of Jammu and Kashmir is 41%. This is Sunil Kohl for AR News from Srinagar.
Telangana reported 21 fresh corona cases yesterday. With this, the number of positive cases has risen to 1,082, while 508 active cases undergoing treatment in hospitals, 46 have fully recovered and discharged yesterday. The number of recovered persons surpassed the number of patients currently undergoing treatment in the state. Our correspondent has filed this report.
In a positive development for Telangana state, the total number of recovered COVID-19 patients became higher than those currently undergoing treatment. The medical data available with the state has revealed that about 40% of COVID-19 patients are in the age group of 21 to 40 years in the state, while 9% are infants and children below 10 years of age, 9% are aged above 60 years. Among the total 1,082 cases, women are 33.5%, while their male counterparts are double at 66.5%. Lakshmi, AR News, Hyderabad.
In a new high, 266 new cases were reported yesterday in Tamil Nadu, including 203 in Chennai. However, the Principal Revenue Commissioner, J. Radhakrishnan, who is the special nodal officer nominated to oversee containment activities in Chennai, has told reporters that the increased count is due to enhanced testing. The increased testing is helping to identify many asymptomatic patients. He expressed hope that the spike in caseload would soon come under control as more and more hidden cases are being brought to light and are being treated. Our correspondent has more.
The 5-member interministerial central team led by National Disaster Management Authority Additional Secretary Thirupugal has reportedly lauded the clinical management of the pandemic being followed in Chennai. They are expected to submit their findings to the Union Home Ministry in a few days. Meanwhile, in Chennai, all volunteers and food and essential items delivery people are to be subjected to COVID-19 testing every 10 days, like other frontline staff. The distribution of immunity-boosting agents like zinc, multivitamins and Ayush formulations to the frontline staff are underway throughout the state. Jai Singh, AR News, Chennai.
Bringing great cheer to Kerala. No fresh case of COVID-19 was reported for the second day yesterday. With the recovery of one infected person, the number of active cases has gone down to 95 in the state. Out of a total of 499 cases in Kerala, 401 have recovered, recording a recovery rate of over 80%. In 5 special trains from Kerala, around 5,700 migrant labourers left for Bihar last night. Himachal Pradesh is set to soon emerge as corona-free state as only one active positive case of COVID-19 is left in the state. Chief Minister Jairam Thakur directed the officers to ensure that persons visiting the state from other parts of the country must follow strict quarantine norms while being in home quarantine. More from our correspondent.
Chief Minister Jairam Thakur said due to collective efforts of the state government and with the active synergy of people, the state shall soon emerge as a corona-free state. Chief Secretary Anil Kachi directed the officers that people arriving from other states must be permitted for home quarantine only after registering their complete travel and contact history. People entering the state have to download the Arogya Setu app as well. Sanjeev Sundaryal, AIR News, Shimla.
Uttar Pradesh government has made it compulsory to download Arogya Setu app for those living in hotspot areas of the state. State government has issued instructions regarding opening of offices and resuming work in industrial areas. Our correspondent has filed this report.
Special instructions have been issued for surveillance management in hotspot areas and containment zones. Now, Arogya Setu app is a must for everyone in hotspot area. If anyone is facing any problem in download and use of the app, then teams comprising members of administration, medical services and police personnel will help them. Administrative and health department officials have been directed for contact mapping of every case in hotspot area. 5 or more persons will not be allowed to gather at any point as part of the COVID-19 management. Chief Minister Yogi Adityanath has appealed to the Jan Dhan account holders in his state to kindly use RuPay card while transaction and withdrawal of money so that there will be no rush in the banks. Sushil Chandra Tiwari, AIR News, Lucknow.
गुड मॉर्निंग सर. आप कौन? सर मैं आपका नया बॉडीगार्ड सेतु. सेतु? लेकिन मेरे पास तो ऑलरेडी बॉडीगार्ड्स हैं. सर मैं एक अलग टाइप का बॉडीगार्ड हूँ. कोरोना वायरस से आपकी बॉडी को सिर्फ सेतु ही गार्ड कर सकता है. कोरोना वायरस से? वो कैसे? सर वो ऐसे कि मैं आपको पहले ही बता देता हूँ कि आपको कोरोना वायरस से कोई खतरा तो नहीं. अच्छा, आपके आसपास कोई कोरोना पॉजिटिव हो तो मैं आपको पहले ही अलर्ट कर देता हूँ. कंटिन्यू. सर और तो और मैं आपको ये भी बताता हूँ कि आपसे आपके परिवार वालों को कोई खतरा तो नहीं. मुझसे मेरी फैमिली को क्या खतरा होगा यार. सर जानबूझ के थोड़ी. अगर अनजाने में आप किसी कोरोना पॉजिटिव इंसान के टच में आ गए तो मैं आपको फौरन अलर्ट कर दूंगा ताकि कहीं आप इस बीमारी को अपनी फैमिली तक न पहुंचा दें. और ये सब सिर्फ मेरे लिए, सिर्फ आपके लिए ही नहीं सर. भारत सरकार ने मुझे 130 करोड़ हिंदुस्तानियों की रक्षा के लिए हर एक का पर्सनल बॉडीगार्ड बनाया है. अरे कहां गया? टेंशन मत लीजिए सर, हर वक्त आपके फोन में एक ऐप बनकर रहूंगा. आप भी आज और अभी आरोग्य सेतु ऐप डाउनलोड करें. सेतु मेरा बॉडीगार्ड है और आपका भी.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, President of Indian Medical Association Dr. Rajan Sharma said that citizens need to follow basic hygiene and social distancing norms, especially when government has allowed a set of relaxations in the third phase of lockdown.
3 चीजें, फिजिकल डिस्टेंसिंग, रेस्पिरेटरी एटिकेट्स, यानी कि कहीं खांसते रुमाल रखें और मास्क डाल के रखें, नहीं तो गमछा. और तीसरा, अपने और अपने आसपास की जगह को साफ. ये 3 मूल मंत्र हैं जो सदियों से चले आ रहे हैं किसी भी एप्लीकेशन में. और अब सरकार जिस तरह कर सकती है, सरकार ने कर दिया है. लॉकडाउन में आपको एहतियात कर दिया है. अब इसके बाद जो आने वाला समय है, हम सबको भारतीय बन के इन सारे मापदंडों में खरा उतरना है. भीड़ भाड़ नहीं करनी है. जितना जरूरत है उतना सामान लेना है, जितना जरूरत है उतना बाहर है.
In an effort to guard against fake news, the government has dismissed a claim on social media that it has started a scheme named Rashtriya Shikshit Berozgar Yojana to provide a relief package of 50,000 rupees to all ration card holders. The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. Anil Gurtu, Professor Medicine, Lady Hardinge Medical College, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1-800-115767. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. And now an overview of today's newspapers covering COVID-19 stories. All newspapers carry photographs of the armed forces paying tribute to Corona warriors in the unique way. Flypasts by fighter jets, playing martial tunes outside hospitals and showering flower petals by choppers. With Delhi slowly gearing up to reopen, the Hindustan Times headline reads, key services to resume in Delhi today, 50 can assemble for a wedding, 20 for a funeral in the capital. Amid job and pay cuts across companies, the Economic Times reports some sunshine from FMCG durable companies. Amid gloom and doom, firms hand out increments and bonuses to keep staff morale intact, with review payouts for current year over coming months. And finally, dig, plant, breathe. The Pioneer says, in chaotic times, families discover that gardening is therapeutic as it gives them hope and purpose. And now, before we end the special news program on COVID-19, the headlines once again. Third phase of lockdown comes into effect with considerable relaxations in green zones. Prime Minister Narendra Modi to participate in NAM summit through video conferencing today.
Central teams being deployed to 20 districts with highest number of COVID-19 cases. Recovery rate of COVID-19 patients improves to over 26% in the country, and Uttar Pradesh government makes Arogya Setu app must for those in hotspot areas. For details of these stories and more, log on to our website www.newsonair.com, and with that we end the special news program on COVID-19.